Coming to the introduction, the burden of congenital heart disease in India is likely to be enormous due to the very high birth rate. Considering a birth prevalence of congenital heart disease as 9 per thousand, the estimated number of children born with congenital heart disease in India will be more than 2 lakh per year. In India, the prevalence of RHD is estimated to be around 0.9 cases per thousand population. 1,000 children in the age group between 5 to 14 years, and presuming that 20% of the country's population is between these age groups, it is estimated that there are around 2.18 lakh cases of RHD in the country. Echocardiography being the most cost-effective tool for population screening and estimating the prevalence of CHD and RHD. In this cross-sectional study, we estimated the demography and clinical pattern and treatment modalities of the CHD, rheumatic heart disease, and obesity in students of 6 school children. Coming to the aims and objectives of this study, to study the prevalence of congenital heart diseases, rheumatic heart disease, and obesity in school children in and around Tirupati. Objectives are to analyze the clinical features of children with diagnosis of CHD and RHD, to assess the various types of congenital heart disease and rheumatic heart disease by using echocardiography, to analyze the management patterns of patients with congenital and rheumatic heart diseases, to analyze obesity, underweight and overweight patterns among the school children, and to compare the BMI among different school groups. Coming to the materials and methods, study's design is a cross-sectional observational study. It was conducted at 6 schools in and around Tirupati, Andhra Pradesh. Duration was it was conducted for a period of 6 months, and the data from school children between 5 to 16 years are collected, and total of 1589 children from 6 different schools between the 5 to 16 years are included in this study. Between 5 to 16 years of school children, whoever are included in the study and who refuse to undergo echocardiography were usually excluded from this study. Coming to the methodology, all school children between 5 to 16 years were included, and data pertaining to the clinical history and clinical examination of the children were recorded in a proforma which was pre-designated. Height, weight and calculated, and BMI was calculated based on the height and weight, and clinical examination was done by the cardiologist, and echocardiography was again done by the cardiologist using a Philips echo machine. Coming to the results, out of 1589 children, 53.3 were males and 46.7 were female children, and most mean age was 12.8 years, and majority of the children were between the 11 to 16 years of group in the study population. And coming to the type of schools, the present in the current study, 52% of the students were from private schools, 22% of the students were from government schools, and 26 from the aided schools like TTD sponsored schools. Coming to this classification based on the BMI, there are 48.7% were underweight, normal weight was seen in 41.6 and overweight in 7.8. Coming to the clinical examination, abnormal clinical examination were found in only 1% of the study subjects, and 99% of the students had normal clinical examination. Coming to the echocardiography, 96% of the students had normal echocardiography, whereas 4% of the children had abnormal echo findings, and 18 children have been diagnosed with congenital heart disease, and 15 were diagnosed with rheumatic heart disease. That accounts to the 1.1% of the students with congenital heart disease and 0.98% with rheumatic heart disease. And severe, mild, and insignificant disease were seen in 1.1, 1, and 1.9% of the children respectively. This is a distribution based on the echocardiographic data. Among the congenital heart disease, ASD was the most common with 6%. Other were found were PDA, VSD, and also VSD with severe AR, DCRV, DORV, and TOF was seen in 1% of the patients. And whereas rheumatic heart disease with severe MR was seen in and AR was seen in 2% of the patients. And bicuspid aortic valve with severe aortic stenosis was seen in one child, and with mild AS and AR was seen in two children. Coming to the comparison of the echocardiographic findings with gender, there was no statistical significant association based on the gender. Coming to the type of school, there was significant association between the echocardiographic abnormalities and the type of schools. The children studying in the government schools had shown higher frequency of abnormalities compared to the students studying in the private schools and aided schools. Coming to the diet also, there was significant association between vegetarian diet and the abnormalities, the number of abnormalities. It was shown that children taking vegetarian diet has shown lesser frequent abnormalities. And the study showed a statistically significant association between the echocardiographic abnormalities and the parents and employment. Children of unemployed parents showed higher frequency of abnormalities compared to the children with employed parents. This is also significant association between the echocardiac abnormalities and the number of siblings, and the children with more than 3 siblings showed a higher frequency of abnormalities compared to the children with less than 2 siblings. There was also a significant statistical difference in underweight children. When you are comparing the private schools, it was 41.6% compared to the TTD and government schools, which was 57.2 and 55.7%. Overall, it was underweight was more common in government schools compared to the private schools. Coming to the discussion, echocardiographic screening was much more effective in detecting congenital heart disease and rheumatic heart disease than combined history and clinical examination. That is 4% in echocardiographic screening abnormalities compared to the 1% which was seen in the history and the clinical examinations. The prevalence of congenital heart disease and rheumatic heart disease in the current study was 11.3% and 9.4% per thousand children respectively. And most of the children were newly diagnosed with CHD and rheumatic disease. That is 91% of the study population which was detected was diagnosed during the screening, and the most of the diagnosed children were asymptomatic. So these were children diagnosed exclusively during the screening and were totally unaware of the disease prior to the screening. And CHD, RHD, and underweight were much more prevalent in government schools compared to the private and aided TTD schools. Coming to the comparison with other studies, the current study had 11.3% congenital heart disease prevalence compared to the previous studies. Ramakumari et al., which was done in Hyderabad, showed 10.4%. In other studies, it was 1.6 to 4.2%. Whereas rheumatic heart disease, it was similar to the prior study. To 9.4 is the present study prevalence of rheumatic heart disease compared to 9.2 in the earlier studies. Coming to the prevalence of overweight, compared to the other studies, the current study showed a lesser prevalence of overweight and obesity. It accounted only for the 10% of the study subjects. Coming to the conclusion, the prevalence of congenital heart disease and rheumatic heart disease in current study is 11.3 and 9.4% respectively, and most of the children were newly diagnosed and were managed at our center, that is SWIMS. And school screening helped in diagnosing both rheumatic heart disease and congenital heart disease even before they were symptomatic. And most of the school screening helps to manage CHD and RHD at early age. And mild and insignificant rheumatic heart disease were observed in 1.1 and 1.9% of the students respectively, and where they were started on penicillin prophylaxis. Thank you.